Hi, and welcome to On Air with Vyaire, podcasts from the front lines, an educational podcast series featuring discussions with frontline medical experts about their experiences ranging from airway management or the dynamics of recognizing, preparing, and managing patients with COVID-19. At Vyaire, we are truly proud to partner with you on the front lines of the COVID-19 global health crisis, and thank you for the work you are doing to help improve outcomes for patients with COVID-19 around the world. The host of Podcasts from the Front Lines is Vyaire Vice President, Medical Director Michael Pedro, MD. This episode is focused on combination therapies for COVID-19 and the second surge, and features our guest medical expert, Dr. Alexander Niven, Associate Professor, Mayo Clinic. This podcast is for educational purposes only. The scientific exchange content in the podcasts from the front lines may address the off-label use of Vyaire devices and supplies that are the sole responsibility of the device or supplies owner, and is undertaken with the understanding that the owner assumes all liability for such use.
On today's episode, we'll discuss how to prepare your pulmonary diagnostics lab for the COVID patient and what protocols you can consider putting in place. Joining us today is an expert in pulmonary diagnostics, Dr. Alexander Niven. Dr. Niven is board certified in internal medicine, pulmonology, and critical care medicine. He's a periodic editor for multiple journals, including the New England Journal of Medicine and Lancet. He has numerous peer-reviewed publications, has given workshops and lectures throughout the world, and currently he's an associate professor at Mayo Clinic. Dr. Niven, welcome.
Thanks for having me. It's a pleasure to be here.
You talked about you're at the peak phase right now and that you're currently doing more urgent lab testing. At what point will you move towards outpatients getting labs done?
Yeah, so you're really talking about broadening our scope from urgent and semi-urgent individuals to more of a broad range of practice. You know, that's a fantastic question that honestly has been something of a moving target. You know, I think that, it's important to recognize that the outpatient practice actually has an important role to play in what technically is a disaster scenario, right? This mass pandemic that we're all dealing with. Because we have lots of patients with lots of different complex chronic medical conditions that if they don't receive the routine care necessary to maintain their level of health, are going to end up in our emergency departments with decompensated conditions and add additional healthcare load to our inpatient setting, which is already struggling with a fair volume of patients, in many areas of the country. So I think it's really challenging to strike the right equipoise behind trying to stay as safe as possible and keep as many people sheltering at home, because again, who are the high-risk folks for developing complications from COVID infections? It's older individuals, it's people who have chronic cardiopulmonary conditions, people with immune-compromised states, and obviously that's a substantial number of patients in an internal medicine or an internal medicine subspecialty practice. At the same time, as time goes by and we've been very successful in terms of flattening the curve, we're now recognizing that we're going to be dealing with a reasonable prevalence of active COVID infections still for months, and these folks, need to get care. So we've chosen early on. We were very proscriptive in terms of the types of patients that we were bringing back. The first patients that we started with were really patients who were going to suffer significant health consequences of further delays in their care. So, for example, a cancer patient who is potentially going to lose the benefits of a curative cancer surgery if they didn't receive that procedure in a timely fashion would be an example. Obviously, our cancer patients receiving chemotherapy and things along those lines has been a very challenging situation, and that's been settled sort of on a case-by-case basis. But as time goes on, we felt that it was necessary to widen the circle of those population of patients to include other folks that, in the referring clinician's judgment, would suffer serious health consequences if their testing were delayed further. And really, as time has gone on, we've left that latitude more and more to the individual referring physician, because it's just impossible for us sitting in a pulmonary function lab doing chart reviews to effectively understand all of the different nuances in terms of the care of all of these patients the providers have been taking care of for years.
Thank you for joining us today. To suggest a topic for future podcasts from the front lines or to stay informed, please visit us at Vyaire.com.